Being that my son does have Tourette's syndrome with self-mutilating tics and obsessive-compulsive disorder, along with anxiety disorder and depression.
When I was 14 years old, my father was diagnosed with bipolar disorder. He was very abusive. I guess the signs were all there. Physically abusive, mentally abusive. However, he never got help on his own.
Both of my children ended up moving out of the house because they couldn't live with him anymore. I would literally go to work crying and come home sick to my stomach, not knowing what I was going to find.
Symptoms of my mental illness, it would lead me to either institutions or jail or death.
And I know I'm not doing good because I didn't have any money for the medicine, and my son couldn't afford $1,000 a month.
If it wasn't without this place, I would not be here. I would lose my life completely.
I had nowhere to turn except to Social Security, and they can only give me so much, and I couldn't get an apartment on that money. And then if they hear that you have a mental illness, it's like, we don't want your kind here.
When Michael became ill, our hopes and our dreams vanished. We were really upset to the point where, to have our son, all of a sudden taken away from us. It was very difficult, especially when we had to tell Michael he couldn't come home. That was the worst thing that I ever had to say to anybody, that you couldn't come home.
We house people and provide support services for anywhere from $7,000 or $8,000 a year up to maybe $30,000 or $40,000 a year at most.
We need more mental health beds. We need more community residences for people who are mentally ill on a permanent basis, and a mental health shelter system that works.
I think that most people don't understand what it is like to go through life having a mental illness, and they don't realize the challenges that we come up against.
If I didn't have options, I wouldn't be able to strive to be the person I'd want to be.
Some people with severe mental illnesses can't really do what they need to do to get better. And that's where having a supportive housing program, which provides services to help them with their self-care, can be an enormous difference. It's the difference between being chronically mentally ill and getting up and being able to become a functioning member in society.
People look at the individual who has the mental illness as having a crisis, but the crisis also affects the family.
Most agencies have lost anywhere upwards of 40, 50, 60 to 70% of their funding. We have less resources than we used to when measured in real dollars.
If we were to lose funding, I think that people would lose a lot of the services that are vital to them now.
If we couldn't find housing for Michael, the alternative being the possibility that Michael would wind up in jail, that he would go be homeless and have to be taken to a hotel by Department of Social Services. The taxpayer would have to pay for that.
So who picks up the slack when there isn't enough support for the people who are doing the support? The family, the people in the community, the policemen, the shelters, the hospitals, the ambulances. It's a lose, lose, lose. At what cost?
Governmental support has not kept pace with inflation. For us, as community-based providers, we need to be adequately funded.
My staff is made up of educated professionals. These people put their heart and soul into working in these kind of environments. And no offense to McDonald's, I love McDonald's, but they could go and work there and not have to worry about medication and incidents and managing someone's day-to-day life and helping someone achieve independence. So the government or the powers that be need to understand that they deserve a wage that compensates them for the level of work that they do.
As providers, we rely on the importance of all the services that our staff provide. We help not only the people living in the home, but we do help the community by preventing hospitalizations, keeping costs down for taxpayers. People are able to live independently in the community. We're able to also be good neighbors.
I think it's about caring for people. If you don't do the minimum basic, even, which is what we're talking about here, when somebody who has a treatable mental illness is not getting basic support services that would help them, say, stay in treatment or stay on medications or keep away from drugs. If you don't give that to them, then there's all kinds of ramifications that are costing not only to the individual and their health, their family, and the community, all the people around them, but it's costing us all.
I hope that, families will understand that, they're not alone, all right? There's help out there.
Since Nick has been here, his relationship with me, as well as my other children, has improved tremendously. Everyone has benefited from this housing being available to Nick.
I believe everyone has the same goal, that if you make a slightly larger investment in some of those upstream determinants like supportive housing, you're not going to give people a better quality of life and also save them and the taxpayers lots of money in the long run.